This is Olga, and Olga's going to be here and holding the charts. These are the charts that I like to show the story of your birth and your labour. You can watch videos if you'd like to online and watch good birth stories, but it's really important that you watch good births to get that into your psychic, into your cells, what a good birth is, how your body's going to work. This is showing you the spine. So this is Olga's spine. This is the front of her body. This is her pubic bone. This is the vagina, the anus and the rectum. And this is the cervix that I'd been talking about. The cervix that before you've had a baby is 3 centimeters long and tightly closed. 3 centimeters long, tightly closed. In this case, the baby is lying with its back on Olga's left side. So the spine is over here on the left side. Her tickly movements would be over here on the right. Big kicks would be over here on the right, or the bottom moving slightly under her ribs on her left side. So this is a body of 36 weeks, roughly pregnant, that the baby is lying in a lovely position, a really good position for birth. As you can see, ready to get in, pointing its vertex, the smallest part of it, over the cervix, getting ready for labour and birth, but it hasn't started yet. Next slide is showing you that labour has now started. So this side, the baby is still lying in the same position, but the cervix has started to thin out. The cervix has started to get as thin as it's starting to need to get, but you can see that there's still a little bit of thickness there. The one thing that I hadn't pointed out with the first one is that this is the urethra and the bladder. And the bladder has to lie, whenever you're this pregnant, has to lie above the pubic bone, which is here. And this is why pregnant women cannot hold their wee whenever they're running, laughing, jumping or sneezing, because the urethra has stretched out so long and there's less room for the urine to be in the bladder. So now this body is showing you that the labour has started. This is the achiness, this is the achy breakiness that I say of early labour. It's starting to feel a little bit maybe in your hips, maybe at the tops of your thighs, maybe low down in your abdomen, just a little bit going on, that you feel that there's something going on. You're maybe having to go on the ball, get in the shower, do something about it. But this is starting to change. The cervix is starting to change. This one is the cervix has now got thin as the skin whenever you stretch your thumb and your forefinger, or as one of my colleagues always says, as thin as your fingernail. And that's what it needs to be before the cervix starts to dilate. And this is now the cervix starting to dilate. And this might be a stage that you're starting to think, oh, I've been in labour for hours and hours and I really need to get in. But in actual fact, this is the coordination part. This is it all starting to fit together, starting your body to work together, going together. And this is where the cervix is now thinking, right, now I can start to dilate. And the baby's head is pressing down on it, helping it also to dilate. So whenever you're upright and forward, that baby's heaviest weight is coming down on you and on the cervix and helping the cervix to dilate. And it really does help this baby along. But now things change. So this is now showing you a cervix that is starting to dilate. The cervix is 4 centimeters dilated in this slide. So these contractions now are regular, strong, long, that you have to concentrate on. You can do this. This is breathing. This is the time where you're doing your different motions, your different mobilities, your different things that you've planned on doing, the 20-minute blocks that you've decided to do. This is also a time that you might be thinking about coming into hospital if you're booked for a hospital birth. So this is the time that you're thinking, yes, they've been going on for a couple of hours now or an hour now. They're long and strong and regular as clockwork. Okay, and you have to breathe your way through them. You cannot possibly talk your way through them. You couldn't say in any way. And if we're on the phone to you, this is the time that it's probably your partner talking to us, not you. You just don't have that ability to do it. This next slide is a little bit of a cheat because it's showing you from 4 centimeters dilated to now you're fully dilated. In reality, The one piece of research that's there is done a long time ago, and it says that first-time mums probably dilate 1 centimetre an hour. To go from 4 centimetres dilated to fully dilated has probably been 6 hours, okay, or possibly been 6 hours. But these contractions are long and strong and regular, and you're coping with it. You can do this. You can do this. The cervix is now fully dilated. Okay, so there's no cervix around the baby's head, and you can see that this is a stage that the baby is really pointing itself into the pelvis, that the bulging bag of membranes, this is what happens with a non-intervened labour, or a labour that hasn't been interfered with at all. That if the baby's been in a good position, strong regular contractions, bulging bag of membranes, and now the contractions will start to change. They'll start getting a little bit expulsive, because this is the time that the baby is going to be coming through your pelvis and out, okay? And there's a change in the contractions. And we often notice it with a woman. We mightn't have to do a vaginal examination, but we'd hear it. So her breathing might change ever so slightly, and she'd be going, and we can tell that she's actually pushing a little bit with her contractions. We don't say anything. This is perfect. This is absolutely beautiful. And we see lots of other external signs of what's going on at this stage. But that's what's happening inside. The cervix is fully dilated. There's a bulging bag of membranes. That baby's head is pushing down. So what happens next? Next is that those waters, there's more pressure being put on them. As the baby's head is being pushed down and the contractions are long and strong, then what's going to happen next is that it's going to be the waters break. And this happens with the pure force of the labour and with being in a good position, and everything is absolutely beautiful. Good, healthy, strong contractions. Waters break, usually in this case they would be probably clear, and that is one of the things that we as midwives look at. This baby is now starting to come through the pelvis, so with each contraction there's a pushing going on. You can't help it. Your body's telling you, I just have to do this. You go with it, and this is what happens. This baby is starting to come down through your pelvis. So each one of these is showing you that baby's head coming down a little bit more and a little bit more and a little bit more. With first babies, this is what happens naturally. They don't actually get ejected straight away. We're built to hold on to them, and we're built for them to just come through very slowly. Part of that is so that you stretch up beautifully, and part of it is to allow the baby to come through safely. So lots of babies, because their bones are not fused and their heads are made to fit through. So they change in shape. They mould to fit through your pelvis. And you'll see in this case that this baby's head is becoming elongated to mould, to fit through the pelvis and come out. And at this stage, whenever the woman is pushing, we'll often say, I've just seen a tip of the baby's head. It's dark haired, it's bald, it's red head, it's blonde, whatever. And we'd often be saying that kind of thing. Maybe your partner's looking at this too, maybe not. You can talk about this and decide this at that stage too. But you can see how the bowel is flattened out. And this is what gives you that feeling of pressure all of the time. It does feel as if your bowels need to move. It feels as if you're the most constipated that you've ever been. But you have to push. You cannot refrain from doing so. And this baby is starting to come through. It still comes through slowly. So next stage, there's a little bit more being seen. At this stage, our pelvises are like a cup. And so the baby's head comes down with the contraction, and your push comes all the way down so that we can see it every single time with your contraction. And then whenever the contraction is gone, they go back in a little bit. Okay, so we see the head, a little bit of the head with the contraction and with your pushing, and then you'll feel it inside as it's being released and being brought back up. okay? But the next contraction, it starts off that the head starts exactly where you left off the time before, which is why you get a little bit more every single time with each contraction. So as you can see, there's a little bit more head being seen at the vagina this time. We see lots of signs because we see the bowel as well. It changes, it flattens out. Women are sometimes worried that they poo at this stage, and they're worried that they're embarrassed about it, or that they think that it's something that they shouldn't be doing, or that they don't want to be doing. But in reality, as midwives, we love to see some poo, okay? Because it means that this baby's head is coming through. This baby is coming out. It's actually working beautifully. Your body is doing it beautifully. You can do this. And it's progress, and it's beautiful. So that keeps going until what we call crowning. And crowning is where the baby's head stays put. Okay, so the push, 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 push has happened, and the baby's head stays in place. There's no more going backwards anymore. So this baby's head stays exactly there. Women talk about this as being the one where the burning pain in their perineum. This is the ultimate stretch of your perineum. Your vagina is fully open with this head inside it. It's stretching the perineum to its fullmost. This is where all those practice perineal massages or whatever else you've been doing on it can help. And if you've done water immersion for labour, that's another thing that can help with it. But this is the fullest extent of the stretch. And this burning, this feeling of this full stretch only lasts for this one contraction that you're going through, sometimes a second one, but very rarely more than that. So you can do it. You can do it. I can do this. But do whatever you've prepared to do. Get ready for that. But it is only for a couple of contractions. So in other words, it's only for a couple of minutes. You can do this. You can do this. This is the time that the midwife's going to be talking to you. Now, I want you to change your breath. I want you to blow out really gently. I need you to be listening to my voice, because I'm going to be talking you through when to push, because we want to make sure that you don't tear, or at least that it's as less a tear as we can possibly make it. So this is a time that you're really tuned into the midwife, and the midwife is really tuned into you as well. And this is the time that you've been practicing those breaths. Your breath has changed now to that candle one, the blowing out the candles. And it's so that you're not pushing. It's taking you away from just that pushing without meaning to push. So you're staying in total control, and it's a wonderful time. You can put down your hand at this stage, and in your hand you'll feel the full baby's head, and it is a lovely thing to do too. Not everybody would like to do that, but it is a very, very nice thing to do. Thank you. Then the next one is the baby's head is born, and that's what happens with crowning. We sometimes see the baby starting to move. Some of them move their faces, some of them actually try and make a breath sound, but you can imagine their chest is inside your pelvis. It must be very difficult for them, but they're absolutely fine. They're healthy, they're well. This is a lovely time. Just take it easy, enjoy it. This is the hardest bit of your labour done. Okay, the baby's head out. That's the biggest, hardest part done. You've done it. Well done. Absolutely brilliant. The next thing is that the baby's body is born, and this happens actually very quickly. So this is shown in 4 slides or whatever here, but it happens really within 1 minute. The rest of the baby is born. And why I say the head is the hardest part is because the shoulders, even though they look wider, are only born one at a time. So first the anterior shoulder slips around the pubic bone and out, and as I said, at this stage you'll have your hands on this baby too. Okay, so the first shoulder slips down first, and then comes out. And we see it, and it's fabulous. Okay, so that's that shoulder, and then the baby second shoulder starts to come out, and this is the second shoulder, the posterior shoulder. So for this, the baby starts to come up to you, And if you're standing or kneeling or whatever your position you're in, putting your hands down and picking your baby up and lifting your baby up onto your skin is what's going to happen. Some of you might be naked because you'll be so hot in labour. Your body's worked really, really hard. You definitely will want to do skin to skin with your baby. It's an absolutely precious time. The baby's cord is not cut, most cases. Delayed cord clamping here. And holding your baby in your arms. What an achievement. What a beautiful thing that you have just done. It is the most wonderful experience. And everybody just takes a moment. There's no rush. Everything is beautiful. Yes, we're assessing the baby and looking at it, but it is just that glorious moment of you've done it. This is your baby, your precious little thing, skin to skin with you, as that little baby starts to breathe, starts to get pink, and just feels beautiful in your arms. Next stage is actually the placenta's birth. Thank you, Olga. So whenever the baby is out of the uterus empties. So it had been, the uterus was up to your ribs with the baby in it. And then whenever the baby comes out, the uterus is empty of baby and it goes down to your umbilicus level. And that sheer dropping and shrinking of the uterus makes the placenta shear off the wall of the uterus. So it literally shears off the wall of the uterus as the uterus contracts down. And the placenta, it might be that you're going to be doing active management of third stage, and active management of third stage is where an injection of syntocinon, synthetic oxytocin being the main hormone that makes your uterus contract. So it's a dose of syntocinon goes into your leg, and that helps the uterus to contract really, really firmly. The research would say that there's slightly less blood loss whenever you use syntocinon and you do an active management of third stage, where the midwife then helps the placenta to be born. Or you may do a physiological third stage. If it's been an uninterfered with birth, you know, there's a good reason for you to do a physiological third stage. There is on the research slightly more blood loss. We do say that yes, you'd be prepared to take syntocinon or the drugs if needed. But with a physiological third stage, what happens is that the uterus shears the placenta off the wall of it, and the woman will often say, "Oh, what's that?" And she'll feel that kind of funny fall down because it's on your cervix. And your cervix doesn't, your cervix is very sensitive, and so you feel the placenta dropping down onto it. And we'd say, just give it a push. Or you might stand up, or you might go and sit on the toilet with your baby in your arms, and the placenta comes all the way out. And then once the placenta is out, the uterus is now emptied, it's at your umbilicus level, and the cervix starts to close immediately. The bladder goes behind the pubic bone, exactly where it should be, so it's wonderful, and the bowel is allowed to open again. At this stage is fabulous, and we check to see what blood loss you have and if you need stitches and this kind of thing, and we're assessing the baby in your arms. But this is wonderful. You have done this birth.